Good morning. I'm John Woodrich, CEO of Bryan Medical Center. Thanks for attending our briefing today. I wanted to share with you our midnight census is 505. We have 33 COVID patients in-house, 24 of those still positive, 8 that are still recovering, and then 1 that is we call clinically positive. In our different levels of care, we have 6 of those individuals in our intensive care unit. We have 6 of those in our progressive care unit and 21 in our general care, with 2 of those individuals being on ventilators. By county, 17 of those individuals are from Lancaster County. 16 are from outside of our county. Once again, I want to thank our community for really just stepping up and making a big difference. We were doing a little reflecting prior to this and was talking about, in November we hit an inpatient census for COVID of around 160. And today, when we're setting down at 32, have made some tremendous improvement, and it's, people taking this very seriously, and social distancing and wearing your mask and washing hands, and people staying put, and it's made a big difference. And now we're in the stages of the vaccine, getting that administered as quickly as we can as it becomes available. Here at Bryan Medical Center, we've given over 13,500 doses. We continue to work with our health department and prioritize those individuals that are the most compromised to get them the vaccine. It's not an easy task to do. I think from a prioritization standpoint, everybody's doing their best. We'd like to get it to people as soon as we can, and we're just relying upon that supply chain. But once again, I reach out to all of those other healthcare providers in this community that have been partaking in these conversations and the planning with our health department, and it's helping us be successful in getting more people vaccinated. Next week, we will have another Facebook Live. That will be on Tuesday at 6:30, and we're going to have Dr. Patera from our Nebraska Internal Medicine, and this will be all in Spanish, and it will give an update. And we actually have one of our board members, Pablo Cervantes, who will kind of be emceeing that discussion that day. So please take advantage of that. We're trying to reach out to as many people as we can to, one, help educate them about the vaccine and making sure that people have access to getting the vaccine. We still encourage people to register. Please take advantage of that, because as that prioritization occurs, it makes it easier to contact individuals and give them the date and time as to when they can get their vaccines. This Saturday, we will be doing another clinic, and those individuals will be notified appropriately, but we will be giving the folks their second dose, primarily pulmonary patients that are at more high risk, as well as dialysis patients. So you will be notified if you're one of those individuals that will be attending our clinic for the second dose this Saturday. I think we all have different opinions in regards to it. I personally would recommend that we continue to stay very diligent and wear masks till we get more people vaccinated. I think it's a little risky. We're all tired of wearing the mask and doing those types of things, and I think we get lax at times. I do myself. But it's what's best to stop the spread or another surgence of COVID in this community. So I personally would support increasing that mandate. I will leave that up to the clinicians, but at least from what we've heard already, it seems like the vaccine that we have are handling those variants well. We've not seen anything that I would say at this point in time causes us some stress or feel that there's going to be something that we need to take on and going to be challenged with. So far, so good. To my knowledge, it's the same, just because we haven't seen that strain or variant look much different than we had from the original COVID. I will tell you, we did look at that, and the case numbers are looking a little heavier than they typically do. You know, we deliver roughly 300 babies here a month, and in some of the future months, we're already seeing about 350 scheduled per month. So I would say, yes, there's been a little uptick, but that's only looking a few months out.